All right. Hello, everyone. Thanks so much for joining us today. Before we get started, we have a brief message for our Spanish-speaking viewers to let them know that this broadcast is also being streamed live on YouTube. Gilbert, you want to take us away?
Buenas tardes y bienvenidos a la sesión informativa donde la doctora Mace nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con la interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias.
Thank you, Gilbert. And thank you to everyone for joining this briefing with Dr. Sundari Mace, our Sonoma County Health Officer. Today we'll include a briefing from Dr. Mace, and then we'll take some questions from media and from the community, and we'll be wrapped up by just around 4 o'clock. Okay, Dr. Mace, you go ahead.
Great. Thank you so much, Jennifer. And I apologize in advance for some of the background noise here. I'm Dr. Sundari Mace and Sonoma County's health officer, and I want to give a few quick updates and then give a slide presentation. Today, I have an update on new business guidance from the state, as well as news on our enhanced COVID-19 strategies, COVID-19 strategies. I want to mention 2 changes issued by the state that apply to our county's professional sports and more personal care services that are now allowed to be open with modifications. We urge the businesses to follow guidelines for personal care services posted on the California Public Health Department website. We also want to urge customers to behave safely in these establishments. Be sure to mask up, keep socially distanced as much as possible, and wash your hands frequently. In other really important local news, yesterday, the Board of Supervisors approved our comprehensive plan to reopen our economy safely. I have some slides that I'm going to share with you in a few minutes. Let me pull those up. Give me 1 minute here. Can you see the slides okay, Jennifer?
Yes, Dr. Mace, we can, and you can even put them into presenter view, which will give everyone just kind of a bigger.
There we go.
There you go.
Okay, so I want to go over the metrics for the blueprint for a safe opening of our economy, and really drill down to what those metrics are. So how does the state decide when it's safe for a county to begin to reopen? There are 3 questions that are asked. How many new people are infected by COVID-19 each day? What percentage of tests are positive for COVID-19? And is COVID-19 harming some parts of the community more than others? And these are the metrics that the state uses to decide when it's safe for a county to begin to reopen. Right now, we are in the most restrictive tier because of the first and the third metric. COVID-19 is harming some parts of the community more than others. As we know, and we've been saying all along, COVID-19 has impacted some communities more than others. These include our Latinx, the low-income, and essential worker communities. Counties must address COVID-19 in all communities to open further, including making sure that the positivity rate in certain neighborhoods, and that is our lowest quartile, or lowest 25% in terms of socioeconomic status, does not significantly lag behind the overall county positivity rates. So how do we determine where this lowest quartile or the lowest 25% of our residents are? We use a metric called the Healthy Places Index, and it measures different factors that predict life expectancy. They look at many different things. They look at education, income, housing, community conditions, health and healthcare. And each census tract in our county and the entire is assigned an Healthy Places Index score. Higher scores indicate greater access to resources. So on the basis of this, we're really focusing on the lower 25% of scores or census tracts within our county, which map to certain zip codes. So in addition to our having a new cases per day per 100,000 population of a certain number that is less than 7 to go into the red, and a testing positivity percentage of less than 8% in the whole county, which we've already met. We also need to have a testing positivity among Sonoma County's residents who have access to the fewest resources. That's the lowest 25% in terms of the HPI index. That is these areas that you can see that are shaded in red. We need to have them also under 8% to go into the red and under 5% to go into the orange. Right now we are at 7.5%. And as a whole, in our county, we're at 5.1%. So we're right on the brink between red and orange tiers for the entire county, and we're right in the red for this test positivity amongst the lowest 25%. And so we're really focusing on economic inequities in our new strategy. And I just want to note that there's a lot of reasons why people in this lowest quartile are challenged in terms of shelter in place or the stay-at-home order, and to isolate. Essential workers have been working from day one, from the very start of the pandemic, when other people were able to shelter in place and be at home. And they live on limited income and can't afford to miss work. So since they don't have sick leave benefits or job security to take time off when they or their family member is sick, that poses a real problem for them to be able to isolate and quarantine. Often people in this category also live in a congregate or shared space due to lack of affordable housing. That's why we're seeing a lot of transmission amongst household members and in households, as well as large work sites. Often people share transportation like vans to go to work together. And we have noted that transmission is occurring in these settings. And then a lack of healthcare access as well. So what are we doing now? And we've been doing this sort of all along ever since day one, when we noted that we had these disparities and inequities. But now we are proposing a fully financed, robust, multi-pronged strategy to reduce the prevalence of COVID-19 in this group. That includes expanded testing. We've been providing pop-up testing and expanded testing to the Latinx community and the most hard-hit areas in our community since April, but now we're going to expand that even further. We're going to enhance outreach to the Latinx, provide financial assistance, which is completely new. We're going to continue partnering even more with our business community, provide isolation and quarantine support close to home, and put forth a communication campaign. So going into these strategies further, firstly, expanded testing opportunities are going to be provided. Beginning this week, the county has doubled testing opportunities with additional pop-up sites in the places listed here: Andes Unity Park, Healdsburg Day Labor Center, Roseland Library, Roanoke Park Library, and we will identify other sites in the highly impacted areas where we can have both people who feel like they have symptoms and those people who don't have symptoms who can come and get tested, just like OptumServe provides for much of our county. And we are targeting the lowest 25% of the Healthy Place Index census tracts in this increasing testing. So we are going back to strategy one. We are going to be doubling our testing over the next month to provide 400 tests in these neighborhoods a day. We're also partnering with a community-based organization called On the Move, who have been funded to implement a large-scale outreach and education campaign to the Latinx and Indigenous communities. This project is known as the COVID-19 Urgent Response Aid Project, the CURA project, and will support multiple different avenues of outreach and support in addition to what we've already been doing. And all of these line with the California state recommendations and playbook for addressing health equity. Strategy 3 is a really new program to provide incentives and financial assistance to those people who are diagnosed with COVID and people who come to test. So we are planning to provide a compensation in targeted neighborhoods, gift cards at pop-up sites for residents in this lower 25% census tract and zip code area to offset potential costs for taking time to get the test and to come to the testing pop-up areas. We will be offering $30 gift cards per person who comes to get a test in these areas. In addition, we are giving a lost wage replacement to facilitate people to isolate and quarantine if their cases or contacts. Specifically for cases, to start off with, we're offering $1,216 for a 14-day isolation period. And you can see if you're eligible at socoemergency.org. Let me say that as we continue to give these financial credits or assistance, we'll also look to see whether we can extend these services to those people who have to quarantine as well with stipends. We are looking to foster our partnerships that already exist with our business community, to work with the Economic Development Board, to enhance worker education for infection prevention and control practices, and to share information on testing and financial assistance programs that are available. Businesses are also encouraged to partner, lead, and invest in enhanced COVID-19 mitigation strategies to help the county progress towards reopening the economy safely. Maybe even on-site testing for our bigger employers. We are going to expand the provision of isolation and quarantine support. We know we have the alternate care site that's up in Healdsburg, and we're planning to secure additional hotel space closer to the census tracts in Santa Rosa, Petaluma, other places that are in the lowest 25%. And we're getting some input from our Latinx community leaders and partnering with our hotel industry to provide these spaces that are closer at home for isolation and quarantine. And we're additionally going to provide gift card incentive for people to come to the alternate care site, acknowledging that it's really hard to leave your home and go to a different location for 10 to 14 days away from family and others at home. And we're also going to provide mobile medical services and that complete wraparound services, such as medication delivery, meal and grocery delivery, laundry services, while people are in these alternate care site locations. Strategy 6 is to create communication and educations as a campaign. And the county strategic communications team is proposing a health equity education outreach campaign using multiple platforms, radio, print and TV ads in Spanish and English, in addition to supermarket videos, social media messaging, geo-targeted digital advertising, to really provide education and other resources, where to seek resources, how to get resources for people who live in that lower socioeconomic strata, in the lower 25%, and to everybody in our community. We're going to continue our partnership with the Health Services Latin Health Work Group to develop these outreach programs and support with On the Move, the Cura Project, and other such initiatives. I'm going to stop there and be happy now to move on towards questions.
Wonderful. Thank you for that, Dr. Mace. So before we pop over to the media and take some questions there, we know that we're getting a lot of questions about the new state guidance. And I was hoping that Adam Radke from County Council, who we have present here today, could just give a brief overview of what's changed.
Yes, so the state yesterday announced new guidance related to amusement parks, related to professional sports, as well as new guidance related to retail, shopping centers, and family entertainment centers. Some of those the state has announced in their press release. Others are changes made within the sector guidances. Those changes can be found on the state website, and the county is currently going through the changed guidances and the changed orders to try to identify what changes exactly have been made so that we can communicate those out to the public.
Thank you, Adam. And so just to be crystal clear, is it fair to say that, when the state is making changes like this, Sonoma County is following with the state? We aren't, keeping businesses closed or anything while the state is opening them?
The local order is aligned with the state order. So as new sectors or businesses are allowed to operate consistent with the state order, then they are allowed to do so under the local order. There's no need for a local amendment in order to allow those changes.
Terrific. Thank you, Adam. I think that'll really help all of our residents and business owners. So then I'd like to pop over to our media, and Ted, looks like you're up. If you want to go for it.
Okay, thanks so much, Dr. Mace. Thank you. With all these focuses now on the very specialized areas of the communities, have you thought about the idea of maybe creating a stationary site that's not the vendor-related one, like we're doing at the Jockey Club or in Windsor, maybe with a medical reserve corps or something like that, to allow more appointment times for some of the people who want to get in and get tested?
Yeah, that's a great idea. And I just wanted to say the state is considering options to expand the testing that they're providing, including other additional sites, maybe even a mobile van, that kind of thing. These talks are happening right now. We're also partnering with some of our other community-based organizations to see if we can actually provide that kind of testing support. In fact, earlier, I had discussed with our faith-based organizations that maybe some of them may be wanting to have some testing on site for their congregations. So there is definitely work being done there.
Great. And then with some of the openings that you're talking about now with entertainment centers, families, and sports, and then the new openings with personal services, do you see any of the ones that are coming up that are potential to be reopening that could be somewhat risky or possible risky in your viewpoint?
Well, I think the state is basing their guidance on the fact that their data doesn't show that there's an increased risk or in terms of the number of cases and things in those sectors that they recommended opening. There's going to always be more risk with anything that's happening indoor rather than outdoor. But I think we'll just have to wait and see what we see here in our county.
Okay, thanks so much. I'll yield to everybody else.
Thank you, Ted. Appreciate it. All right, Martin, you're up.
Hi, Dr. Mace. I'm doing a follow-up on this outbreak over at this residential care facility in Roseland, and I understand that some people have been have been hospitalized from that facility. There are currently 15 residents there who are all COVID positive. Many of the staff, if not all the staff, have tested positive. The owner is telling me that they do need help. I got a call from a woman whose father is 99 years old, a World War II veteran, and she's hoping he can make it to 100 by June, but she's very worried about her father, and she's just asking me if there's anything that the county can do to supply more help. This is not a medical facility, but these people are all sick with COVID. Is there anything that the county can do to help these people out, to help this facility out, aside from testing and guidance?
Yeah, no, I think that we are providing technical assistance and support to the extent that right now is possible. I haven't heard directly from any facility seeking further additional assistance at this time, but I absolutely think that we can provide further assistance. We're also calling the Healthcare Associated Infection Team and the Department of Social Services from the state. They've already been with this particular facility to provide assistance, guidance, and I'm hoping the state can actually potentially step in and help more with resources as well.
I missed a little bit of that. You broke up there where you were talking about what the state is providing.
So Department of Social Services is responsible for the board and care homes, which is long-term care facilities that fall into the residential care facility category. And they are helping us with staffing needs for this particular facility. There's also an ombuds person who works with all of the long-term care facilities.
Mm-hmm.
Person is also involved to see if this particular facility can get some assistance.
As a follow-up, we saw that during this late summer that our cases in our residential care facilities and our particularly our skilled nursing homes those cases were declining. Are we seeing that still, or are we starting to see an uptick there?
Well, actually, if you look back on the data, and Kate, you can jump in here. I believe that our skilled nursing facilities have decreased significantly, as you know, And we only have 22 or 23 of them in the county. The issue with the residential care facilities is there's a lot more. There's a little over 200 such facilities in our county. Potential for much more introduction of COVID into those facilities if we have more community transmission. So I think we've been seeing a slow uptick in those facilities. I don't know, Kate, if you have that data right on hand, or if it's Jen who does, but I think we have been seeing, as the skilled nursing facility situation improves significantly, a slow but steady uptick in the residential care facilities.
Thank you.
Certainly. And
I didn't know if, Kate, do you have anything to add to that?
No, you captured that accurately.
wonderful. Thank you, everyone. Okay, let's go to Phil Barber. Phil, there you go.
About elder care facilities as well. First of all, I just wanted to make sure I was understanding clearly. My understanding is the state has approved inside visits for family members with under certain safety guidelines, and that you have approved visits outside at facilities. Am I getting that right?
Yeah, we made the decision, and our guidance, Phil, came out before the state guidance.
Okay.
But just to clarify, but we have determined that for the very reason that we're seeing this slight uptick in our residential care facilities, that we've finally seen a good decline in cases in the skilled nursing facility side, that right now, given that we're in the purple tier, meaning that we have widespread transmission of COVID still within our community, that we would like to start with outdoor visitation and see how that goes first.
Right. I'm wondering if you have any suggestions or recommendations surrounding mixing of elders within the facilities. For example, there's an older husband who's in assisted living, and in the same facility, the wife is in memory care. Do you have any concerns about them spending time together with, hypothetically, without knowing details?
Well, I mean, that's a very specific situation that you're bringing up. Generally speaking, what we would say is that we want to try to avoid mixing of people without social distancing and facial coverings as much as possible. I mean, I think that's what we can say. It's up to the facilities to ensure that they are enforcing the best practices. That would include social physical distancing, the facial coverings, and the general hygiene measures. And, I think we kind of leave it at that, because the facility should really be the one that determines very specific recommendations, like the hypothetical situation that you just asked about.
Great, thank you very much.
All right, thank you, folks. So let's go ahead and take some questions from community. Fred is asking, he owns a restaurant. And so he's looking at, how does he get ready for wintertime? Can he have a tent? What are the tent requirements? And would you like to offer any guidance that our department has issued or the state has issued on that?
Sorry, I'm going to turn that over to Adam, because I think he has very specific guidance on that. And let me just preface it by saying we really do understand the challenges that are coming our way with the weather getting colder, and with restaurants having difficulties with the fire code and regulations in terms of outdoor heating and things. So we understand that, and I wanted to, we'll clarify what the state says, and we are going to work really closely with this sector moving forward.
Thank you, Adam.
Yes.
Thank you.
Yeah, I can answer that question. So the county does have an FAQ for businesses that may want to operate outdoors. That FAQ can be found on the SoCo Emergency website in the shelter order C-1915. What it says is that outdoor operations may be conducted under a tent, canopy, or other sun shelter as long as no more than one side is closed to allow for sufficient outdoor air movements, and that local permits and licensing requirements may still apply. The county has also reached out to the state to try to see if the state might be able to provide further guidance for fall and winter weather on what kind of arrangements can be made for outdoor operations so that it can be done so safely under winter and fall conditions. The county believes that, you know, the state needs to address that area, especially since, you know, the fall and winter season is coming up, and we don't want a 58 different county approach on public health precautions on this issue. So we are working towards, you know, issuing further guidance as it relates to fall and winter weather, but the current FAQ is online, and that's what I would advise, at least at this time.
Thank you, Adam. We appreciate that information. We have a question from Fernando, and Fernando is asking about how, you know, if you test positive and you live with 8 people in your household, do we have any guidance or resources available to people to help them isolate or quarantine?
Absolutely. And I think it's a great question. Thank you for that question. If you're diagnosed with COVID and you're worried about infecting your family members or whoever lives with you, we have the alternate care site. So far, it's a hotel that is in Healdsburg. We will provide transportation. We'll provide a room with full services in terms of meals that are actually culturally appropriate, different types of meals, as well as medical care as necessary while you're there to isolate, so that you don't have to worry about infecting your family. And this is one of our key strategies to try to limit the number of cases that we're having in Sonoma County. With the new initiative that the board has just approved, we are going to be identifying and contracting with up to 35 other hotels in and around the Santa Rosa, Petaluma, Roanoke Park, more central areas, as well as potentially find a few such hotels in Sonoma Valley or Cloverdale, different places, so that people have a place close to home where they can isolate. So we are definitely working on this, and I think we need to get the message out that if you get diagnosed with COVID, you should absolutely consider going to an alternate care site.
Terrific. Thank you, Dr. Mace. And I think that brings us to our time today. So I just want to have a moment to thank everyone who participated in today's briefing, you know, watching, submitting questions, to our media partners, really key folks helping us, you know, share good information with the community, and Dr. Mace, to yourself as well. And our interpreters, ASL, Brenda, and Spanish as well. So thank you, everyone, and we will be back next week, same time. Take care.